I believe that Jill deserves this award because she goes above and beyond whenever it has to deal with patients or just talking to you one-on-one. And that's paramount for patient care and for feeling like you're not just a number, but part of a community of people that are working together.
Pre-COVID, as employee health nurse, my job consisted of pre-employments, workers' comp, FMLA, leave of absence, handling short-term disability claims, and then with COVID, a lot of things got added. So I then had to continue doing my previous tasks in addition to the new things that came about with COVID.
So yeah, I came in and I was feeling a little, nasty. So I had got tested by Jill in HR and I was negative. A couple days passed and I started feeling even worse and I went to the ER and then that's when I found out that I was COVID positive. And that's when everything changed. When I first went home sick, we were trying to get oxygen and stuff for me at home. And Jill was a big help with that. She even brought stuff and put it on my porch, of course, for a contactless visit. And she even offered to bring me ice cream when I was at home. She was a big help. I just remember reaching out to her, but I was out of work for a whole month. We only have Jill, that one employee health nurse, and she gets help from other people, but at the same time, she is the person that got it done.
So once COVID happened, the leadership team got together and determined what the best processes were going to be for us. And so as the employee health nurse, it was easy for me to quickly understand that I was going to be front and center in finding processes to mediate the situation in regards to the team members. Found a process to facilitate testing. We facilitated a drive-through testing method for our team members who were symptomatic. I was also able to find ways to communicate to the team members and to their directors. I worked closely with the lab to coordinate those things and the health department. We also had to figure out how to best work with these team members that were out sick because those were team members who weren't on the front lines helping take care of patients. These people were at home trying to get well and to take care of their families. So it was my responsibility to communicate with them, make sure that they were well, and let them know when they were able to come back to work.
When I first got sick, I convinced myself that it was just the flu, that I'm immortal and, this thing's not going to get me because, I work around things like that all the time. And so they said, you need to call her, you need to call Jill. And so I said, okay. Well, whenever I called her, I told her that, she said, yeah, that sounds great. Why don't you come in and get tested anyway? And so she was very approachable from the beginning. And whenever she called me to let me know that I had indeed tested positive, she, was like, hey, go ahead and stay home. She's very friendly, and reasonable, knowing that I had, not believed that I had it. I would say she went above and beyond because Jill really let me know that, you're part of the family, you're part of that community with her. She checked on me regularly, and wasn't just like, the basics. That she would talk to me about, like, how are you handling it? How is your wife handling it? How is your family? And had this personal level to the amount of care that she gave me that has translated since then. Like, whenever I see her, I'm like, that's Jill, you say hi to her, Yeah, she's very, very, very professional, personal, yeah.
When the first COVID cases overseas came about, we kind of thought, or I I assume most people had the same thought that I did, where you assume it's not coming over here. And then as the cases started getting closer and closer, you kind of became more aware that it was going to affect you in some way. I just didn't realize how much it was going to change my daily tasks. I remember when the first patient came into the hospital, or the first team member became positive, and you really start caring for all of these people who are scared of what is going to happen. So I was able to be a resource for them and to reach out to providers on their behalf so that they could get medications, or they could get treatments or medical equipment that they needed because they were too ill to do it. Some of the challenges that I encountered really had to do with balancing the work-life aspect. COVID also took my kids out of school, and my husband and I still worked full-time jobs. So we were trying to balance finding places for our kids to go, ways to get their schoolwork done, and ways to continue to work. Despite all the things that were different, we did want to maintain some kind of normalcy for our kids, because I feel like they were very understanding in the fact that, you know, Dad and I still had to work and there were so many things going on. To kind of bring in some normalcy, I helped my daughter's softball team. So to help coach that and to allow her to participate, that did bring a piece of normal back into our life. I feel like that was very important during that time. When it comes to juggling work and the phone calls and school and trying to keep up with all the different things coming at you at once, I really think just prioritizing those and remembering what was most important. You know, I wanted to be there for my family, but it was just as important keeping my community safe, keeping my peers well so that they could take care of the people in the community, because my family's in that community.
I think it's an honor that my wife, Jill, gets to receive this Mercy Award through all the stuff that we've been through COVID, her going to school, the kids being out of school, us having to teach them, coaching softball, juggling her lifestyle just to be a mom and a wife to us. It's an honor. She works her tail off, and I think she deserves everything she gets.
I'm truly honored to receive this Mercy Award, and I know that every team member, every person that works in healthcare can relate to the situations that I encountered. So I not only accept this award for myself, but on behalf of all those people who overcame the trials that came with the past year.
For so many healthcare workers, this past year held a remarkable amount of change. We dealt with a new disease, new treatments, new guidelines, more struggle, more death, and more perseverance. When our recipient, Jill Irwin, employee health nurse, was faced with a major pivot in her daily responsibilities, she didn't bat an eye. She worked with others to implement new processes and schedules so that she could fit in the need for constant care for our own team members while maintaining all of her normal duties, including attending classes for nurse practitioner school and, most importantly, caring for her husband and 2 young children. While she has always looked after the well-being of her team members, COVID added an entirely new, sometimes life-threatening layer. Since last March, Jill has tested and tracked 611 of her co-workers, with 274 of those resulting COVID positive. She has provided helpful care information to those who were sick, called on them to check their progress, fought alongside all as their primary point of contact for PRMC. She has also been instrumental in our COVID vaccine clinics. Making communities healthier is our mission here at Paris Regional. Jill has gone above and beyond to care for our own throughout this pandemic. We owe you so much, Jill, and we couldn't be prouder to have you represent us as our 2021 Mercy Award recipient. Thank you for everything.